Aviation Ministry's advisory to airlines, in fact, the MOCA, which is the Ministry of Civil Aviation, says comply with passenger facilitation norms, no visibility impacting flight operations, passenger safety is paramount. The Ministry of Civil Aviation is asking the DGCA, which is the regulator, to ensure compliance of passenger facilitation, directing all airlines to strictly comply with passenger facilitation norms in view of prevailing fog and low visibility conditions impacting flight operations. Airlines have been directed to strictly comply with passenger facilitation norms in the interest of passenger safety and in the interest of convenience. Amit Bhardwaj has more details on that story at this point in time. Amit, take us through the details of what has now been said by the Civil Aviation Ministry, given that, inconvenience is guaranteed during this time of the year if you're traveling to and from Delhi and many other parts of North India as well. There is heavy traffic also, given that this is the holiday season. What is the specific advisory?
Rightly pointed out, Sneha, it is not only about Delhi but also about North of India airports. Rather, the fog conditions are impacting the flight operations across India. And that is why now orders have been issued by the Ministry of Civil Aviation in context to customer facilitation. Now, what was happening is that the Ministry was continuously monitoring the situation as to how delays and disruptions are happening and whether customers are being, treated properly the way they should be as per the norms. Now, the order that has been issued by the Ministry of Civil Aviation has been given to all airline operators, and they have been told that timely and accurate flight information has to be given to the passengers. Meals and refreshments need to be extended if there are any delays. There are prescribed norms in place. If there is certain amount of delay, what certain refreshments or refund or rescheduling options should be provided to the passengers. All of that has been mentioned in this order. And the ministry has also said that no denial of boarding after timely checking should be done. Assistance during diversions, because many of the times we see that if certain flights was bound for the national capital because of the fog conditions, it had to be diverted to airports such as Jaipur. Whether a proper assistance is being given to the passengers at these airports, alternative airports, and whether, especially for those who are from elderly or PWD categories, whether they are being provided proper assistance or not. The order is very specific in this context as well. Moreover, timely refunds, baggage facilitation, and effective grievance redressal is what the ministry has asked all airlines to follow. Along with this, the DGCA has been mandated with the responsibility of ensuring the compliance happens, as well as the constant monitoring of the situation at airports, and the operations, flight operations, is to be done by the DGCA. Back to you.
I'm going to leave it there for the moment. Amit Bhardwaj getting us up to speed with those details as far as the very latest in terms of the instructions given to the regulator by the Civil Aviation Ministry is concerned here. Of course, the situation is worrying. There would be a cascading effect as far as delays are concerned, and that is going to lead to chaotic conditions. However, having said all of this, this isn't something that is unusual. It does happen during this time of the year, particularly in northern India. Let's now tell you about how Delhiites are choking in toxic air, facing health problems associated with lifelong smokers. But in Parliament, the central government claims there is no conclusive data linking air pollution to lung disease. In a written statement in Rajya Sabha, Minister of State for Environment Kirti Vardhan Singh has said a direct relationship between AQI levels and lung diseases has not been firmly established. The minister did acknowledge that air pollution is recognized as a triggering factor, though, for respiratory ailments and related diseases, but said there is no conclusive evidence to establish a direct link. Doctors have repeatedly warned of shrinking lungs, fibrosis, irreversible damage due to prolonged exposure to polluted air. Fine particulate matter, which is PM 2.5, travels deep into the lungs and lead to fibrosis, reduced lung elasticity, chronic obstructive pulmonary disease, asthma, heart disease, and even premature death.
No doubt the parliamentarians have a lot of other jobs to do, but they cannot, at this very moment, cannot overlook what is happening to our air, to what we are facing, the pollution and our breathing problems. People are choking. And at the long term, it's not just the choking and breathing. You can get cancers, you can get heart disease. I'm not saying really it's going to happen in one day, But people who are already in a position where their lungs are not good or they're commonly exposed to throaty issues or chest issues, they are choking, you know. So that's the thing. We have to do something about it. Doesn't matter whether the parliamentarians are busy. This is one job that they have to do for the moment. They can come back to their own job after a while. But let's sort this out. Find a way out.
These days, with these kind of air pollution levels, our OPDs, our emergencies, our wards, our ICUs are flooded with people, not only chest diseases. People think that this air pollution only causes lung diseases. Yes, lung diseases are in majority, but it also causes heart attacks, it also causes brain attacks, and it causes whole lot of other diseases also, including diabetes and obesity. There is data to prove that each of these diseases is linked to air pollution.